everyone. Welcome to another one of our live sessions here inside of mypeptideuniversity.com. I am your co-founder and El Presidente, Dr. Melissa, and we are talking all things business tonight. Now, you guys could be the best clinicians in the world, and you are because you're here. You're continuing to really dedicate yourself to ongoing advanced learning and practices so that you can show up your best each and every day with the clients and patients you serve. And I genuinely, truly commend you. The way that healthcare is evolving, it is going faster than many of us can keep up. Trust me, and every day, this is what I'm dedicated to. And I will go down rabbit holes and go, holy moly, like there's a lot happening. And so we can get so focused, right, on caring for the patients in the way that we know how to do best, that we can sometimes miss what is necessary to really secure our business so that we can keep showing up as our best. We need both physical health as well as financial health, emotional, spiritual, all the good elements that comprise our well-being. So tonight we're going to talk business structures. As we know, peptide therapy typically falls into a cash pay category. So straight out of the gate, I want to hear from you guys. How many of you are fully cash pay practices? Tell me about your practice model right now. If you're hybrid, are you still insurance? Are you dabbling in cash? Are you all cash? And then I want to know how you are delivering your care. Are you single service, kind of transactional? Are you running programs? If so, how long, what types? Or are you more of a membership model? So drop it in the chat. That's going to help me a lot tonight to really have some context for where you guys are at. But I also want to know where you want to be. So you're here, you're showing up. What's your questions for tonight? And if you're not really where you want to quite be yet in your practice, tell me about that. Share your vision. And I love it. Oh my goodness, I do, as always, love having you all here. Peptides Cash. Okay, and Maureen, you said Peptides Cash. So is your practice just peptides? I want you to give me a little bit more detail about that. Switch to all class. Yes, Dr. Amy, you sure did. Okay, single practitioner, full concierge, telemedicine, nationwide membership model. Dr. Phillip, fantastic. With initial consult packages and then a yearly membership. Excellent, excellent, excellent. That's really great. Membership programs for Brian, Nicole, all cash 6 and 12-month programs. Lots of full cash practice. That's amazing. It really is. Yeah, Leo, I was reading you. Wellness, HRT, weight loss, peptide programs, packages, all cash. Bonnie, you're all cash. Are you typically, is it transaction? Is it membership? Is it programs? And you guys tell me your biggest, your most successful program. If you're running programs, tell me what it is. How long is it? And I would love if you feel also open. We're here. This is private. This is us. You're among your peers. What are you charging for it? Right? So one of the things I'm wondering is how y'all feel about asking for cash. Who's doing that inside of your practice right now? Is that you? Is it you? Is it your front desk? Who's doing it? Because if it's not you, do you know that it actually should be you? You are the most influential person to your ideal client. So when it comes to making that recommendation of what they need, why they need, and how you can help them to achieve the outcomes they want, one of the most profitable places for you to sit inside of your practice is in the place of actually doing those consults, doing the assessment, giving the report, if you will, that's going to kind of break it all down as to what they need and why they need it and how you and your team, the products, the solutions, the programs, the memberships that you offer will get them there. Now, you don't have to collect the money. You don't have to book their appointments. You've got other people in your team. So let's talk about how many of you are actually doing that and how many of you feel like a rock star doing it and how many of you feel really uncomfortable doing it. This is a moment of honesty. Got some solutions for you tonight. Okay. So I want to know where you're at. Megan is asking for payment. And Megan, you are always showing up with so many you participate so beautifully. Thank you so much. I'm wondering if you do me a favor, tell us, how do you feel asking for payment? Do you feel really comfortable with it? Do you feel a little unsure with it? I'm going to invite you to come off mute if you're able for just a moment and give us a little context, Megan, about if you're.
Yeah, thank you. I did unmute myself. I feel uncomfortable. I have a lot of money problem myself and getting better because I value what I do and how I can help others. And I have to understand that not everybody are able to afford me, and I give them the options of the using credit card and other modalities to be able to afford. However, I have to come to and I have so much problem. Still, I do. I said, like, still haven't had my pricing set up because of that problem. Like, I'm bouncing between 5K to 2K to 900. It's like, so I
Oh,
know it's been bad. And then membership, I don't know where I'm standing. Sometimes I'm 140, sometimes I'm 99. So I'm not there yet. And that's why I'm here. I'm like, I need to dial this down because it's confusing me and my clients.
I'm so glad you're here. First of all, thank you for
Thank you.
sharing that. And so I just want to just hold you in a space. Again, there's no judgment here. And listen, as entrepreneurs, small business owners, especially when we've come from insurance and we move into cash models, we are just kind of fumbling our way through often, right? Until you land in a place like this where you've got a community, you've got crowdsourcing, you've got people that have walked that path before you that have done it successfully. I really want to thank you, Megan. We're going to break that down tonight. And I want to talk about the fact that there's fluctuating prices. Really, again, I applaud you for just being honest with yourself to say, I've got a money issue and I'm not comfortable. So we're going to talk about that. Okay. I'm going to come back to that. So before I dive in, and I'm just really grateful, there's two other people I want to highlight for a moment. So Shri, you said you wanted to offer something up really quickly. So let's have you come on. Hi, my dear. It's so good to see you here. And then I also want to come over to Seraph as well.
So the first part of the question, in terms of comfort in asking money, I have moved from being extremely uncomfortable about asking money to extremely comfortable about asking money, realizing the value that we bring. I was selling myself short. So that hurdle I have gone through. But in terms of telling the price and explaining everything, I haven't gotten to that part yet. We just say this is how much it's going to be. This is how much your investment is going to be. But I still feel like there is a part of me that, given the choice that I can have that job handed over to somebody else instead of me doing it, I would rather do that. So I would prefer to get advice from you to get to that point where I'm going to sit and do it, because it was profound information to me hearing from you that I should be the one doing it and not my front desk staff. I was always taught the other way around, that the doctor should never talk about money. He should just talk about medicine and the other people should do it. So please tell me how to change that mindset.
I love it. Okay. Thank you, Doc. I respect you and I appreciate you. And I so thank you for sharing that. We're going to take just a moment. I've got several of you that I can see on video. If any of you are able to come on video, I want as many faces right now for the next question. And Sarah, I'm coming to you in just a few minutes, if you don't mind. I know you're driving. So as many people that I can see your beautiful faces on video right now, this is going to be important. We've got more of you than eight. Yes, come on, keep it coming. Keep it coming. Come on, I need a few more faces, a few more beautiful, wonderful faces, please. Karen, eat your dinner, enjoy it, my darling. Nourish yourself. That's beautiful. Dr. Carol Cook, I need to see your beautiful face. Come on, we've got it. Brian, come on, guys, don't be afraid. And Dr. Amy, can I just say you look super stunning tonight? I really love your hair back. Hello, goddess. So good. So good. So good. All right, who else? Come on, I need to see more beautiful faces, more handsome faces, more wonderful faces of you, our incredible members. Brian, great to see you there. Nicole, thank you for being here. Leo, yes, my friend, do you have something that you needed to ask? So here's the question, and I want you guys to answer this with me right now. Do each and every one of you, honestly, and there is no judgment if the answer is a no or a yes, I just want you to check in with yourself, okay? Do each and every one of you honestly believe in the results that you deliver to the clients and patients you serve? If it's a yes, give me a yes. I want to see hands up if you're able to. Seraph, keep driving. Don't take your hand off the wheel.
Absolutely.
Seriously. Okay. And I mean this. Do you? Yes. Yes?
Yes, ma'am.
Is there anybody, and it's okay if you don't, is there anybody that's questioning, maybe you're new, maybe you've transitioned, you're kind of like, I don't know, I still feel like I'm going through a learning curve. We're going to create a container tonight that's going to support all of you, okay? So there's a reason I'm doing this. Anybody here doubtful about what you're delivering? Is anybody here doubtful about the results that you're delivering, the outcomes you're getting with your clients or patients? Anybody? Learning curve. Okay. I'm going to put it, yeah. Okay. All right. And I'm going to mute you all for a minute. So step one, Shri, you just asked about this. It can seem uncomfortable to ask for money. However, you guys are not selling anything. You are all experts You're experts. You're experts in your field. You've all gone through an immense amount of years, right? In training, in school, in programs, and then more years, boots on the ground, knee to knee, in, emergency rooms, yoga centers. We've got a lot of different types of practitioners, but you guys have all been working with real patients, real clients. That's expertise. Now, the reality is, I can feel, especially right now with peptides, everybody is like, excited about peptides. And everybody wants to, when you look on social media, everybody wants to matter and everybody wants to be recognized. Like that's part of the human experience. So I'm not judging or shaming. And people want that attention. And so what's one of the things that's getting a lot of attention right now? It's peptides. So you're finding house moms, you're finding teenagers, you're finding senior citizens, like all in the peptide train, right? And they're out there, they're posting, they're talking about it, they're talking about how it's changed their lives. And as a clinician, it can sometimes feel like, wait, like they're talking about it. Well, I want to talk about it, but can I talk about it? Should I talk about it? Do they know more than me? They're good. Like, I don't know if I know as much as them, but I'm supposed to know more than because I'm a clinician, I'm a doctor, I'm a coach, I'm a this, I'm a that. And we can go into analysis paralysis. We can feel like we are imposters or not enough to some degree, especially in this current lane of everybody seems to be a peptide expert, but nobody actually is. So take a moment and pause and give yourself a little love. I don't need you guys to be influencers. I'm really not trying to, I don't think the goal as a clinician, I'm going to tell you, we all took oaths as whatever type of practitioner you are. We are here to do no harm. We are here to give and love and serve. We are here to help to facilitate, right, a path to resources that can provide healing, support, correction in that human system. We are not here just to sell a product. And I'm not downing anybody who that's their gig. As influencer marketing is real, and that's how a lot of people pay their bills today. So I'm not downing it. However, and this is where I want you all to feel good, and this is how we're going to move into the money conversation. We're going to talk about how to set things up, and we are going to talk to Sheriff here in just a moment. Seraph, excuse me, is you have to value you first. So if we were to take money aside and it wasn't about the price tag, do you value? Do you believe in what you do? Do you know that you know your stuff? And if any part of you feels like, I don't know my stuff, then don't overextend yourself. Stay in the space where you feel confident and dedicate yourself to learning. That's why you guys are here. Because when it comes to showing up, when it comes to showing up for your clients, for your patients, to build programs, to build new services, here's the truth. And this is why influencers are amazing. They scare the hell out of us as clinicians because they're so brazen. They don't give up F, because they're just like making some money and they want some likes and they want some shares and they want to go viral and they don't care if it's real or not. They just want the hit. They don't care. I'm not saying shame on them. I'm saying like we could all learn from them to have a little confidence. Now we have licenses and everything else, but here's where I'm going with it. You have to be one step ahead. One step ahead. One piece of information, one article, one lesson, one knowledge, one thing that all of a sudden, like even if you have a very educated consumer base, patient base, they're still overwhelmed because they're scrolling all the time and they don't know what is actually valid, what is true. But more importantly, and here's what I want you guys to feel really good about. If you've heard nothing from me over the many months, peptides are amazing, but it's not about the peptide. Peptide is a tool in your toolbox. It is a hook of curiosity. It is a powerful tool to aid in your clinical care, aid in helping to deliver outcomes. It's not the solution, part of the solution. It's not, hear me, the solution. And what each and every one of you are able to bring that no influencer can, is you actually, you have clinical acumen. What you learn here inside of Peptide University is our clinical framework. You understand how to think about when, where, why not, how much, how often, right? You begin to lean in and appreciate how to support a more comprehensive approach to your client's care. So just feel good about that. There's value in that, and people are lost. I'm going to tell you all, and Shri, I'm going to come back to you, and then Seraph, and then I'm going to bring up my slideshow, and anybody that's got questions, put them in the chat. And I actually had a talk with one of our members yesterday. So when I was one of my most recent talks at South by Southwest, large group talking on GLPs, I had a line out the door when I was done of consumers coming up to me saying, Melissa, can you help me? My doctor has put me on these and they just keep increasing my dose. They don't know what else to do. I don't feel good. I've plateaued. I don't know what to do. I'm just looking for help. I'm looking for information. And so then I have to go and give the whole disclaimer. I'm not your doctor and this is educational, informational purposes only. And if I were to consider, so I'm sitting there giving some guidelines, some guardrails for them to understand how to think about this. But that's what I want you guys to hear. Yes, the consumer is like hooked on peptides and they're going down the rabbit hole, but they don't know what it means except, oh, GLP, weight loss, VPC, I'm going to heal my tendons. Oh, Wolverine. Oh, glow. I'm going to get some cool skin. Like they're just hooking onto a trend. They don't necessarily really understand the implications in the human system. And this is what's powerful. So one of our doctors yesterday, Dr. Wendy, are you on tonight? She said she might not be able to be here, but I'm going to give you a marketing, a concept, a solution you can use in your practice right away. I told her because she's functional medicine, she's lifestyle medicine, and she's just like, I want them to have, they're on the molecule or I want to get them the molecule, but they're missing everything else. Everything else is a mess. Their nutrition, their fitness, right? And we all see it every day in our practices. And I said, so why don't you actually offer a program for people that have failed on GLPs? Are you failing on GLPs? Failing? You've plateaued? Don't know where to go? Don't know what else to do? We can help. So I want to encourage you guys, when we think about business, I don't need you guys to be Me Too's. There's enough influencers being Me Too's. I need you all to show up as clinicians. I need you to think in an intelligent way to go, well, you guys are seeing it every day. You know the conversations you're having with people. So when you're not sure, I invite you to step back and imagine that you are an observer of yourself, almost like you're a consultant to your own business. And if you were to track the most common questions you get asked, okay, the most common conversations that you have, that gives you information about when I say the field, I mean like the field of human beings right now. What is the collective showing up with? And I would encourage you guys, throw some of your common questions that you put it in the chat. Let's just take a poll to see how many of us are getting some of the similar questions. I'd be really curious. I know we have different types of practitioners here, but let's put some questions in the chat so we can unpack these a little bit together. Because the moment that you start to hear the same thing asked more than 3 times, 3 is a pattern. I need you to go into pattern recognition. As clinicians, you guys are really good at pattern recognition, okay? So all we want to do is recognize a theme, a trend, here is this thing. So now what can I do with this? So there's a couple of things that you can do when these trends and these patterns show up. All of a sudden it can inform you to say, well, this is happening all the time. What if I were to do maybe I want to do a class that's free marketing. I could do a Wellness Wednesday, peptide pontification. I don't know. I have no idea. Like, come up with something fun, right? But the idea is you're going to answer. Here are the 3 most common questions. And you can say, boom, boom, boom. If you're wondering this, if you're feeling like this, if you're dealing with that, come to this class. It's free. Bring friends. We can help. Okay. Don't ever, if you've got space inside of your place, or if you've got partnerships with a local fitness facility or something like that, you can do classes. You could do Zooms. You could do a podcast. You can do a video. You can have things that are just on your social media. It could be a post, right? So it depends on how you want to use it, but just realize that it can inform programs you might build. So in Dr. Wendy's case, she's like, they're just stuck and they're not hearing me and I want to do this thing. And I'm like, so offer a program for that. Like that's your hook. It's still your program. It's still, but your hook in is, have you stalled? Have you failed? Don't know where to go? Stuck? We can help. You're not alone. It's not your fault. We can help. Hey, you've been missing some information. We can help. Okay. So does that make sense to everybody? Okay. So Shri, I'm going to come to you and then Seraph, get ready. You're coming up. So Shri, for you, it's first and foremost, and this even goes back to Megan. Many of us have our own money issues. And one of the things as healthcare providers, and here's really the big one, is, as a healthcare provider, it got really easy because we got to just do the part we love to do, which is to show up and care for these humans. And insurance did the rest. Insurance made sure they sent us people. Insurance made sure we got paid. We didn't have to worry about all that other stuff. But somewhere along the way, we realized, wait a minute, we're not actually in control at all of patient care. We are being forced, told what to do. And none of this actually gets a patient well. It's an insurance carrier is telling me what they need. They're not sitting here with this patient. They're not hearing their story. They're not looking at their history. They're not understanding the complexity in front of me. A plus B does not equal C. And so the longer we've all gone through this, the more we realize, oh, these insurance companies really aren't here to help the practitioner or the patient. We're just driving up costs so their shareholders can make a lot of money. We are burnt out. Our patients aren't, and we have an epidemic, right, of everybody's broke and sick. And we're living in decline, and that's got a cost on every level. And so as we've gone through this, especially over the last decade, as premium insurance all of it's gone higher and people are paying out of pocket more and people are looking at things differently. And then COVID happened, and then people became distrustful of the allopathic and the way things were. They're like, there's a lot more going on. And then peptides came on the scene, and we're seeing more and more where people are saying, managing problems isn't giving me what I want. How can I find a solution? They're spending $450 billion annually on average out of pocket cash pay expenses by the consumer for what is termed wellness services. And peptides fall in that. And so this is real. People are spending. And so I'm going to invite you all to realize that if you're offering cash, you're no longer part of the insurance mob, no longer under their control. Now, you still, as a clinician, you are still going to make appropriate clinical decision making. You're still going to do due diligence and note taking. You're going to give best care, and you're still going to follow kind of the guidelines that you would in the standards to do no harm, right? However, when you step out of, does it have a billable ICD-10 code, and now it's cash pay? We're really looking not at managing a problem to ensure that we can get our $27.52 from that actual $150 billable service. We go, okay, what am I doing if I'm not managing problems? I'm delivering outcomes. Holy moly, it's a paradigm shift. And then it makes us question, do I believe in my capacity to support this human to achieve outcomes? And this is where a lot of us get stuck. Yes, a bit of it's about money, but it's also, can I do the job? And here's why I tell you this. Because too many of us take ownership of that outcome. As doctor, you think you're supposed to fix a broken system, a broken person, a managed state. Doctor means teacher. You're not here to fix because people aren't broken. They're out of balance. They're overloaded. They're under functioning. They're over functioning. They're crashing out. They're burning out. They're not recuperating. They're not repairing. They're not regenerating, right? They're losing capacity. They're losing resilience. They are accelerating the rate and pace of biological aging, which leads to breakdown, dysfunction, and chronic disease. So they are on that path to it. That doesn't mean they're broken. Their system is doing exactly what it was designed to do. And so it's keeping up with the demands and the resources or the lack thereof coming into that human system. And so when we come into a cash model, it invites us to set our egos down at the door, or our fears down at the door, or our pride and everything in addition to, and realize that human is the same as me. And we want something different. We want something real. They want support. They don't want to feel crazy. They don't want to be given another prescription that doesn't actually move the needle. So where do we start? And the first place to start is to appreciate that your role starts to shift in a cash pay practice. It shifts from the responsible governor of codes to facilitator, guide, teacher to direct these clients to the access that they need. So if they need peptides, you're helping to give them access. If they need certain therapies, you're giving them access. And you're doing it in a way, and here's the value, and I need you to hear this. The value is you've got the experience. And in fact, I'm going to show you something. I'm going to go to my share screen really quickly because I do have slides. So let me bring up some slides for you all tonight. Slideshow. All right. I want to, and this actually ties in with what I'm saying right now and money and all of it. When they come into a cash program, cash offering, cash practice, there's a journey that they take. And you, as a clinician and your team, have to all of a sudden take on different skill sets because you're no longer just submitting paperwork to the insurance company. You are now actually looking at marketing because the insurance company markets for you. And now when you don't have that trade-off anymore, you've got to understand how to market for yourself. And this is one of the areas that many of us feel like we struggle with. However, when you know what you do, you know who you help, you know who you serve, you know what you love to do, you know what you're excited about, you show up and share it, talk about it, be about it. And I'm going to give you a structure about that tonight. You will attract the very people that you are here to support. But once we start to get their attention, now we have another problem. We have to actually enroll them. How do we take their money? This is the very thing we've been teeing up tonight. How do we take their money and feel okay about it? And so that's another skill we have to learn. Once we learn how to start to take their money, to enroll them into whatever our solutions are, whether it's transactional, membership, programs, anything and all, packages, then we actually have to know how to deliver it. So it's not just a twice a year visit or a when they're symptomatic and they come in every once in a blue moon. When you're in a cash pay practice, there's a rhythm, there's a cadence, and you start to sell outcomes. Nobody's going to pay you money to manage their problem. They're going to pay you money to help them get free of their problem. They're going to pay you money to have outcomes, to have new expressions of who they want to be, how they want to feel, how they want to live. So they're not going to pay you money to manage the problem. So now all of a sudden, the next thing we have to solve for is how do I actually deliver this? What do I do first, second, third? And in what order? How do I do it in a way that I don't just give them a 20-page protocol? Here you go, come back in 3 months. Nope, no, you don't. That's not how it's done in a cash pay practice. So there are very specific steps that have to occur. And what's really interesting is when we go through this is real simple. All of a sudden, we look and we say, gotta love my really fancy art. You right now, people have problems. And whether I'm good and I want to be great or I'm terrible and I want to be less terrible, somewhere in between. They start at a beginning point. They're somewhere and they want to be somewhere else. Okay. So I always refer to that as where they're at versus where they want to be. So where they're at is they're in their problem state, they're in their challenge. Where they want to be is the opportunity of what they are saying, I'm ready for this. In a cash pay practice, we get to be so that we can feel good about asking for money, about building programs, products, packages, services, collecting the money, delivering the care. Our opportunity, we're no longer a paper pusher. We're no longer just a technician of a quick in and out in a script and we're gone. We get to get good. Okay, as my son would say, Mom, get good. And then we get to get goaded. I know, there it is. If you don't have a teenager, then you might not know what the heck I'm talking about. But for those that you do, you know. So the reality is going, okay, I get to get good at understanding the solutions they want, they're looking for, not just to lose weight. For what reason? How do you believe your life will be when you lose the weight? Why is losing the weight actually important to you? And why is that important? And why is that important? It invites us in to human psychology, human behavior. We are all emotional creatures and we are motivated by pleasure and pain. Sometimes you've all heard it. I'm sick and tired of being sick and tired. I'll do whatever it takes to get out of the pain. Or this is really good and I'd like it to be a whole lot better. Like this is really good. But most of us are just kind of somewhere in between. And it takes a lot to get us into a state to make us move and to create change. And so there's a lot that goes into the psychology of how these people come to you and where they're at on what's called the readiness scale, their readiness of change. From a marketing standpoint, most people out just surfing the web and going through scrolling and whatever, only about 1 to 3% of the high end will purchase in 30 days from coming into contact with whatever that is. Now, on Instagram, they've got us dialed in. Anything under $100 will pretty much take the bait on pretty quickly. And if it looks like an irresistible offer, we're like, what could it hurt? When we start to go over 100, especially over 150, you go anything above that, we pause a little bit. We might we've got to really love it. It's got to really speak to our value system or who we think we are as a human to have that thing. So luxury items, we might buy a little faster, but healthcare usually isn't a luxury unless your brand is luxury and people are coming in because they want to be luxury, right? So there is that side of health and wellness, and peptides fit in that as well as they fit in chronic care. And there's room for all of us, but we have to understand the solutions that these people really want. And when you know that you can deliver these solutions, and the fact that you guys know about peptides, I'm going to tell you can deliver any solution you want. Because the reality is what we have right now, for the most part, again, we've got some great supplements, vitamins, those are substrates. They're going to give back kind of what's been depleted. Okay, but they don't necessarily correct. They support So breaking down, building up, breaking down, building up every day, things are coming in. Do I have enough to keep up with it? So we need certain substrates just to keep the ATP going, just to keep the engines running. Hormones, those are really important, right? So if we got hormones, we're going to get some better outcomes. But here's the deal. Medication doesn't actually, for the most part, actually heal. So let's just take the case study of BPC 157 as an example for a moment. It's actually a repair signal in the body. It can actually help to repair injured soft tissue, repair it, not just like reduce the pain of it. Take a Tylenol and hope the inflammation goes down, and you put an ACE bandage on it, and then maybe some scar tissue forms, or it's still ligament laxity, or we still have an unstable gait and it's going to get re-injured again. We actually heal. And why everybody loves Wolverine so much, BPC 157 plus TB 500, component of those two together, not only do they accelerate the healing of soft tissues, but they actually also reduce, like there's a less likelihood of reoccurring injury. And a lot of soft tissues like sprains and strains, so many of those things there's a lot of biomechanics with it, but historically we know once we got it, we're susceptible to them. And we seem to have takes longer to heal. We have them more often. When we start to bring in these molecules, of course, with functional movement or therapeutics, we create correction. So you guys already have solutions that very few clinicians actually have and know what to do with. And so all of a sudden, that should help you to feel really, really good, because now you can start to shift your own inner value system. Let me not make it about the price tag. If I were somebody that really was struggling to lose weight, and all I wanted, and I'm just going to use this as an example, and all I wanted to do was to get the weight off. I feel like I'm losing my life. I'm going to lose my marriage. I'm going to lose my job. Like this is just crushing me. I'm unhappy. I'm depressed, blah, 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 blah. Would I pay? Would I pay for a solution to be supported and not just to get it off and have it come right back? Because I've done that 20 other times. I've struggled with weight loss. Most of these people have. How do I get it off? How do I keep it off? How do I be supported? How do I figure it out so I get my body back and I get my mind back and I get my heart back and I keep my life and I make my life better? So most of these people, like if you have a money problem, if any of you are uncertain, don't make it about you. It's never about you. That's our biggest issue. We make it about us. It's not about us. It's about that person. Why are they showing up? What do they want? What do they need? What do they believe that you have the potential and the ability to support them with? If you know that you can support them, they will pay. So how about, instead of, can I do this? Should I do this? I don't feel good doing this. Then go, oh, well, this has nothing to do with me. Let's just reframe it. Quit making it about you. Shri, I say that with love because you're a pretty awesome human and I like making it about you. But right now we're going to make it about them. So it's just saying, hey, Sue, once you've done a consult, Sue, listen, my role is simply to be here to, and well, actually, before I do that, before I do a little role play, I'm going to show you, we actually have a consult form. I'm going to take a pause. I'm going to stop my share and I want to see if, Seraph, are you still here? Are you still with me? If you are, come off mute, please. Or is he gone? He was driving in here. Is he here? Yes. There he is. All right, let's have you and I have a chat. All right, tell me about your practice. So you're already doing cash pay. On average, you're doing 5 to 15K programs. You're doing a lot from what I was looking at in your thread with peptides already. So talk to us, just help us all to understand your practice, if you will. Share with us how you and your team successfully, confidently offer these programs from 5 to 15,000. Was there a time that you didn't feel comfortable offering these? Have you always loved to just, price was never an issue to you? Talk to us a little bit about your learning curve and how you and your team got to the place you are today of delivering programs in the way that you are, please.
Well, it's an honor, Dr. Melissa. I've listened to many of your sessions, and we have our staff learning under you right now. I'm a chiropractor for 10 years, and my wife is a chiropractor, and we met in chiropractic school, but we've always been interested in holistic medicine and really integrating the modern medicine in the Western world along with the holistic approach and building a model that it's cohesive and not so, left or right sided. And patients really enjoy that and love it. So our practice is really simple. I mean, we implemented peptides several years ago, and it's just been on another level of recovery. So I enjoy the business aspect of it. I'm the visionary, I'm the leader in our office, and working with medical doctors is just a privilege now that we can, integrate together and really work well for our patients, because ultimately it is all about the patients. Nobody cares about you, what you have to say. Take your hand out of their pocket, which is for our staff. I'm realizing if any other doctors needs help, I am willing to hop on a call at any point. Please reach out to me. I invite you all to try certain things, just play with it with a patient or two, how you present packages. We offer integrated medicine with functional medicine, and then obviously peptides has been a huge part of our practice now. And I'm telling you, if you got to find a niche of who you're presenting this to, because not everyone can afford these things, and it's okay. They don't have to say yes. You don't have to please everybody out there. So I started focusing on more of the higher ticket items packages. And to be honest, I'm working on something so massive that it's like a white glove service that these people want. And I mean, to spend $150,000 a year on optimizing your health with other physicians and cardiologists, chiropractors, oncologists, PTs. People are looking for this stuff. And it's exclusive type of like access where like it's like a membership for 20 people. And it's amazing. People will pay this money. So $5,000 to $15,000 to ask for $15,000 for me is nothing. But I would highly suggest, if you can try something to do, is when you are offering something, when you're making the offer, you are already having them say yes multiple times. Like you said, Dr. Melissa, paint the vision of what they're going to feel. How are they going to enjoy their family? Paint that vision of the experience that they will have, the way they will feel in 2 to 3 weeks or 2 to 3 months. How long is it going to take? So having options at the end is crucial. Most people say, I have 3 options for you, Mrs. Smith. This option 1 is the basic care plan that I would do. I really don't recommend this for you because so-and-so, we're not going to get you there. This middle grade plan is the advanced, more of the essential care plan that I have for you. And this is custom made for you. These are the goals that we'll reach by this time. And you're starting like painting a picture. So they're already nodding for your care. You already answer so many questions in your consult. And then, you kind of guide them to which direction you want them to choose. And then the most advanced care plan, this is what I would recommend, Mrs. Smith. This is what, you told me on your consult. This is how we're going to get there. This is how you're going to feel in certain points. And then I always say this is the biggest thing that I say for my patients. I am not a Chipotle menu. When you come to us, you let us do our job so we can make you feel better. So you can't just go into our clinic and say, I want beans, I want rice, and this and this. Even though you might create a really good burrito, we just don't allow that, because then you're kind of the influencer. It's like, oh, I just want to try BPC 157. Well, let's back up a little bit. Let me get your goals and so forth. So if you can, and then one thing I mentioned in the beginning, I learned this a long time ago when I was a personal trainer. Take your hands out of somebody's pocket, because they will surprise you. Don't make those assumptions that they don't have money or it's uncomfortable. And then the biggest mistake people make, Dr. Melissa, is they're thinking that they're selling. So your staff up front is going to be anxious. They're going to be, if you have a girl or a guy or whatever, they might not be good at asking for $2,000. And if they're like, so today, Mrs. Smith, it's going to be $2,000. How are you going to take, they're mumbling. That is no good. Mrs. Smith, today your treatment plan is $2,000 by Dr. K's recommendations. How would you like to pay? We take cash, credit card, and push-ups. I make a fun thing. So it's the confidence that comes across is going to show in the patient as well that these people got it together. Dr. K is really, he's confident in this. But the psychology is, if you're thinking you're selling, you are going to get uncomfortable. I waited, and this is crazy, guys. I waited 6 minutes in silence, approximately 6 freaking minutes, when I asked which plan sounds the best for you. And I just stood there and I just wiggled my feet. And it was so awkward, guys. If I can do it for 6 minutes, anyone can do it. And this is blowing my mind, because I see a lot of patients, like, still love my chiropractic stuff. And I'm so caught up in day-to-day, like, seeing patients. I would love to venture out and just teach clinicians how to grow a cash-based practice. We have about short of 4,000 patients. And this is just a quick story, guys. I took an x-ray. I said, Ms. Jones, this doesn't look good. Like, this is wrong here. We need to get an MRI of you. This was about 4 years ago. We need to get an MRI of you tomorrow. She's like, you know what? Let's start treatment us, and maybe we can do something. She wasn't responding. 3 months later, we got an MRI after she went through this whole ordeal. Guess what? Pancreatic cancer went to her spine, found out we lost her life. She lost her life in 2 weeks. My wife and I had a meeting that night, and we were like, screw this. I cannot lay my head down anymore, guys. I'm like anxious to treat my patients. I feel the gut wrenching, gut feeling that I will never go against again. The intuition is there. God has given us the intuition. Go with your gut. It will take you so far. We called every insurance company the next day, Dr. Melissa, whatever it takes. I am out. We're not doing this anymore. Even though pancreatic cancer, I don't know if we would have saved her in any way. Maybe we could have gave her like a few extra months with her family, but we call it quits. Close to 4,000 patients in a month that we got out of network. We lost 12. 12 freaking patients went somewhere else, and they had great insurance, school teachers and things of that nature. Very rare policies. But you got to keep in mind, people are willing to pay for the care, and you hit it on the spot. These influencers have no clue what they're doing. They're maybe affiliating with a company, and they're getting a kickback. It's great. You can make a ton of money doing peptides. But all of this is going to crash really fast. In a way, it's not going to crash that is gone. It's just the infrastructure will get too overwhelming. And I think the people that are doing it right, slow, steady, interventions, doing all the things that are right, people are falling back to that because people are saying, they're not losing weight, they're stalling. There's a problem right there that you can solve for them. So if you can take one thing from me, I don't know many of you, but I do enjoy this stuff, and I'm so passionate, is take your hand out of people's pocket and just make offer and shut up. That's it.
Phenomenal. Doc, thank you so much for sharing
So
that.
good. So very good.
Oh, good. We will have you back on. We'll unpack that, more of that on another. And for all of you out there running successful programs, you're doing it and you're doing it really well. There's many of you that had said so in the chat. We want to highlight you guys. We are crowdsourcing. It is not just the Doc Melissa way, not even a little bit. We've spent a lot of time, a lot of years. I've consulted and coached thousands and thousands of practices and practitioners. So we've got the right guardrails for you. We're not going to let you steer the wrong way. But what becomes really important is when you hear it from other people, right? Because I love, Sarah, how you just said, take your hand out of your clients' pockets. And I've always said, don't spend your clients' money for them. So same exact thing, right? I also say, don't let the inmates run the asylum. And he had a defining moment where he was allowing the patient to dictate what they thought their care should be. And this is a really important thing, you guys, when you go into cash practice. You have walked this journey many times before with them. You know that the majority of your patients need to do A and B and C and D and E. Now, it may not be a straight line, but these are kind of the core ingredients that they're going to need to address. Some faster, some slower, some immediately, some secondarily, but there's elements. So I told you, you're great pattern seekers, right? And so you already know, listen, like it's going to take some things. There are certain elements that have to be addressed to reclaim stability in this system so that healing can occur. And that's your expertise. It's not just throw one more thing onto it. I say it all the time, good can become bad in an overloaded system. So even a good peptide can become bad or useless in a system that is not ready to handle it. All right. So when you know kind of I call them the breadcrumbs, the steps along the way, the different ingredients that will ultimately come together to produce results or not. Your job is if you're building anything beyond a single visit, and even if you're doing everything in a single visit, then you already know certain things that need to happen on these visits. Now, all of a sudden, you start to do the single visits enough, well, there's kind of a sequence. Like usually in the first 90 days, we're doing this and this and this. In the next 90 days, we're doing that. These are some of the themes we're coming up with. These are the conversations I'm having with at least 80% of the people. Those are the ingredients that go into your programs and or your memberships and or your packages. I'm not here tonight to try to tell you how to sort for which one you want to do. We go deeper into that, especially in the accelerator program, but know that there's multiple ways to run a cash practice. All right. There's not just one way. It's what way works best for you. You meet yourself where you're at. You get good where you are. So if you're doing transactional things, then get really good doing transactions and set a goal. Like, can you increase your patient visit? Can you increase your the bill of the visit? Like, is there an add-on that's appropriate, not just to sell them, but that's an appropriate add-on, right? So we've done that in different conversations where I show you the power of an upsell, the power of a point of service. Like what difference does an extra $10, $50, $150 look like cumulatively, visit over visit in your business? It adds up. And so there's different ways that revenue can be generated. So as you understand the pieces to the puzzle, this is what becomes really important. This is going to inform, do I know how to do those things? Do I feel confident? And so what Dr. Kay just talked to us about is he said, hey, I've got 3 packages. So basically he took all the pieces, all the breadcrumbs, and he created, and I teach you guys this all the time, good, better, best. Good is, what's the bare minimum? What's the bare minimum to get them from here to here that this has to happen or we're not going to get the result? Better is, okay, it's the bare minimum plus a few extra things that if we can add those few extra things in, it's going to be a little easier. They're going to get there a little quicker. They're going to stabilize a little faster. And best is, this is my dream team. This is everything I want, that I know if I have all this, and this produces the most optimal outcome, period, end of story. Okay. So you know your zone of genius, good, better, best. For him, it's like 5, 10, 15K. It doesn't matter what the price tag is. And so, it can be back to Helen. It could be 99, 129, 149. If you bounce back and forth and you don't know what you want to charge for things, okay, be kind to yourself. You're figuring things out, but don't waffle with a patient. You can always go up, real hard to go down. If you go down and you have repeat people, you're going to question your value. You don't want to keep giving discounts and you can always add value, right? But if you keep going down and down and down, so wherever you start, you want to do a check-in. If I were going to go pay for this service, if I needed the same thing that they're coming to me for, would I pay this? Now, it's not about you. It's not about you, but you have to believe in it. You have to believe in that service. You have to believe in that outcome. You have to believe in what you do and how you deliver it. And so if you are out of alignment, right, and you're like, I just wouldn't pay. You can't make, just like you said, take your hands out of their pockets. You can't make your money issues their money issues. You get to say, all right, let me start to have a new conversation with money. And that can be something you can work on in time. But step 1 is just reframe it, and don't make it about you. Make it about that client. Make it about their journey. Make it about their outcomes. And if you've got the confidence that you can do that, again, then this is where we go into the 4 phases of care. How do we attract them? How do we enroll? How do we deliver? Now, there's too much for the time tonight, but I'm going to go over a couple of key things I want to leave you guys with, and we'll wrap this up. We'll be out of here by 8:15, just so you know, because we've got Michael and I have to be on a plane tomorrow morning. We're gonna get this all wrapped up. Hopefully some of you will be able to join us at ECO in Boise this week. Really quickly, the first thing is attraction. How do we attract? How do we attract this person that we know we can help? Okay, so for those of you who have never had to market, you feel weird about marketing, you're not sure if you can compete with the influencers. Marketing is just what's referred to as a funnel. It's a bridge of communication from out there to in here. From people that don't know about you, they follow this lovely little bridge called the know, like, and trust factor. It's the law of familiarity. We all go through it as consumers. We have to know something is even out there to decide, do I like it or don't I like it? No. Oh, there it is. Do I like it? Do I not like it? Like, oh, I kind of like it. Liking it. I'm going to keep following. I'm going to keep my eye on it. I'm going to read some things. I'm going to watch some things. I like that a lot. Man, that doctor really knows what the heck they're talking about. I'll start to trust them. I trust. So trust is built in a multitude of ways. Trust is built with 5-star reviews, right? Trust is built with word of mouth. Trust is built with legacy brands. Trust is built with testimonials, before and afters. Trust is built with research. Trust is built with you showing up and people already just feeling you, seeing you, knowing you, and going, I feel it. That intuition is saying that's where I need to be. And when those ingredients come together, then it's like dating. I know you, I like you, I trust you enough. I'm going to give you my digits. That's when I give you my information. I'm going to become a lead. I'm going to say, I want to know more if you might be able to help me. And sometimes these people that know, like, and trust you, they're never going to need you, but they know other people that do, and they'll become great referrals into you, advocates of your brand. So when we show up, whether we are showing up online or offline, these are some, really essential things that you need to understand about yourself, about the clients you serve, about the outcomes that you deliver. What is that your clients that you might have all these different client types, but what are your main clients? Go run your numbers and look, we talk about this all the time. Look at who's showing up, who's spending money with you. What are the biggest chief complaints, outcomes that you're delivering that people show up for, refer in time and time again? You might deliver 20 different services. What are your top three? Out of your top three, what's your top one? What's driving the most income, the most traffic, the most opt-ins, the most repeat visits, the most referrals, the most? Your pattern recognizers. So look for the pattern. So that's going to tell you a lot. So who is that person? What is that outcome? And what is it? Why are they showing up for you? What is it that they really want from you? So again, I use the example all the time of weight because everybody wants weight loss. It's the number one most requested service, solution, result, end of story, period, in any marketing data, like at all. I just met with a large company this week with over 47 million Americans. The number one thing, I wrote the number somewhere. I don't have it in front of me. So that out of the 47 million, 23.6 million, the one thing they wanted was weight loss. It's the only thing they wanted, weight loss, right there out of the gate. Okay. And that's a little glimpse of what it is every day when you look at marketing statistics. So 93% of Americans are metabolically dysfunctional. So we've got a big issue. We can help. What do they really want? Well, they think they want to lose weight, but what do they really want? Why do they want to lose the weight? How do they want to be feeling? What do they believe their life will be like when they've lost it? So who is it that really wants what you offer? Why do they really want it? What would they have to know or believe about you in order to say yes? So like Dr. K is going, like, he has such confidence. And I will tell you guys, confidence always wins. He was so confident. He was able to stand in silence. How many of you could do that? That's tough for probably a lot of us. You know, as I've grown in myself, I've realized one of the ways that I overfunctioned for far too long is I would step in because of my own discomfort. I didn't want to wait long enough. I didn't want to deal with the crap show that would come when they would mess it up, right? I'm like, it'll be faster and easier for me to take care of this. But I couldn't just stand in the discomfort of somebody else finding their decision point. And as I started to get better with that and go, you know what? If things wobble, they wobble. If things fall, they fall. People are either going to get good, they're going to get clear, they're going to make a decision, or they're not. But it has to start within us first, right? We're all mirrors and reflection points of one another. So what is it that they'd have to believe or know? Like they'd have to feel so confident in him that he was willing to stand there for 6 minutes and just hold that space. And even though he was wiggling his toes, he's keeping it together, but he held that space. And they were able to come through and say yes. Okay. Maybe they would have said no. Either way, it would have been okay. It's the what is it that needs to happen so they say yes to you? What do they need to believe? What do they need to know? And where are they already? So again, when we think about who are we here to help, to support, to serve, that need our peptides, that need our services, that need our cash pay goodies, they're out there. Where are they? Where are they already showing up? Where do they already do business? What groups are they involved in? Are they moms? Are they blue collar workers? Are they third shift workers? Are they executive athletes? Like, who are they? They all have patterns. They all have trends. They have things they follow. They have places they shop, places they do, other service providers they work with. Those are all referral points. Those are all networking opportunities. Those are all strategic collaborations. When you align with that, it makes your marketing a lot easier because it's not you trying to say, look at me, look at me, look at me, I'm selling myself. It's you're a trusted resource with other brands, businesses they already do business with. Build your network, build your referral network, build your brand alliance partners. So we're not going to really talk about how to structure things tonight, but with just the last few minutes, I do want to touch on this quickly. And we will do maybe next month, we'll do a dedicated class on this because, you know, I go deep on this all the time over at Human Longevity Institute. It's one of the main things that some of you are my students here tonight. You started with me over there and you're here. You know, we do a lot about this and we role play this often because when you have to ask for cash, okay, when you are going to convert non-paying to paying, and you might not be the first person. So a consultation could start with somebody else before you. Whenever you're going to get to the real ask, they need to land with you. So in the beginning, you know, there's a process I always refer to lovingly as weeding out the tire kickers. You are not supposed to be giving away your time for free and talking to every 15-minute consult that comes through your door. However, that 15-minute consult can do a lot to truly align the ideal clients that will ultimately buy the $5,000 program. And nowadays we live in a time that we can have so many things already pre-done. We've built a lot, even at Peptide University, we've been refining all this so much. So we've now got a full AI phone system that's trained on me, trained on the way I talk and the way my customer service department talks, so that we can answer things real time and take them through a lot of what would be like a consultation. There are psychological things we want to ask people when they're going to make a decision. We want to get them into a ready state. We want to assess how ready are they now. And it's interesting because Seraph was already saying it. There's 3 words when you're talking with somebody that reinforce. You always want to get a minimum of 3. You always need a minimum of 3 yeses, head nods. Okay. You need them going, yes, yes, yes. Like, oh, this makes sense. Oh, I'm following you. Oh, this sounds exactly like what I'm looking for. Oh my gosh. Don't ask, do you have any questions? No. Don't ask them for no's. Ask them for yeses and let them say yes. Let them sell themselves to you. Paperwork, intake processes is a way that they can already tell you why you, why now, why no other. When we do a little complimentary consult, and if you want to charge for it, you can charge. I'm not telling you to do it for free. That's another decision point at another time. But this is really the whole point of a consult, is just to determine if they are the right client for you and you are the right solution for them. Not everybody is a fit. And in cash pay practices, one of the first lessons you'll learn the hard way, if you're not aware of it, is if you just take everybody, you will have many headaches on your hands. You'll have many non-compliant customers. You'll have requests for refunds. Okay. You'll get people saying this isn't working. They can go out and give you low reviews, and all of a sudden they can hurt your brand. So this is for you as much as it is for them, and not about like, oh, I'm going to collect a check. You want to bring in the right people. You know, one of my mentors years ago said, hey, a consultation should be like getting accepted to Harvard. You are Harvard. The patient, you don't need the patient. And I don't mean this in a negative way. They need to know that they need you. So they get to apply, they get to audition, so to speak. So we too often think we have to sell, we have to convince, and we have to, no, you don't at all. So reframe that it's all about them, it's not about you, and reframe that you don't need to sell anything to them. You are there to educate, to guide, to listen, to determine if they're the right fit for you, you're the right fit for them. And as you go through a very simple conversation, then you're going to, and this is already in the paperwork, you know, we do a lot with this to train you guys on it. Your paperwork can already answer the questions that will identify the key drivers in a conversation that really matter. We don't need to hear people talk to talk. We don't need a lot of fluff. We want to get right to it. And one of the questions I ask all the time, what's the number one most important outcome you want to get from this consult, this visit, this session, right? This talk? What's the number one? You're showing up. I'm showing up. I want to make sure it's a fair exchange of time. I'm not going to guess, right, what I think somebody wants to talk about because I put a couple things on the paperwork. I'm going to say, what's the number one most important thing? If we could only do one thing today, what's that one thing? So now we know exactly what we need to focus on. And you can always double check. All right, Sue, I saw the number one most important thing that you wanted to talk about is you wanted to know if you should be on peptides. Okay, I just want to check before we go into this consult, is that the most important thing you want to talk about? Why is that the most important thing? Well, I've heard from everybody and I'm following this influencer and I've been buying some from China and I'm trying them and I'm getting all these really crazy results and I just don't know if I should be trying them. Well, now, you know, they're just trying to get some free advice from you, right? So you might go, okay, so what is it that you really want the peptides for, right? So sometimes we're going to ask a couple of questions, but it helps us to calibrate, engage, and know a lot about who's in front of us. And then we're going to pinpoint and communicate the exact desired. All right, Susan, what I'm hearing is you want to know if peptides are really right for you to effectively release weight and get your body back, get your energy back, get your confidence back. Does that sound right? Yes. Great. Gain agreement. Does that sound right? Yes. Is that what you're looking for? Yes. Would you like support with that? Yes. If we could help you with that, would you like to know how? Yes. Okay. Affirm, invite. Feel, felt, found. Sue, I feel that what you're telling me is a very normal request. You may have felt before confused, uncertain, but we have found here in clients just like you, because we help many people with very similar questions, just like you, around their metabolic health, is that there's just 3 simple things that they need to do. And we do those here inside of our program. If you'd like to find out if you could be a candidate for a program, then we're happy to move to the next step. Okay. Simple, simple, simple things, gang. So again, there's a lot more nuance to it. And I love even what Seraph said that, hey, just start to play. So one of the best places to play is just having a conversation. And so oftentimes you can role play that with your staff, role play that with a family member, role play that with a friend, role play that with yourself. I tell you guys, I used to do that all the time. I still do that. Like I got to go give a talk on Thursday. I will be giving my speech to myself. I will be rolling through the things, even though I've done it 1,000 times, 1,000 different ways. I want to like lock it in. Like, where am I at today with this? What's resonating in me today? On my way to work, I used to talk in my mirror to myself. All right, Melissa, so what's bringing you in today? So it's okay. Just play with the conversation. And that's where you'll really start to feel confident. And so here's kind of a little bit around feel, felt, found and around weight loss. Sue, what we've found is that most people in your situation aren't failing because they lack willpower. And this, like, she would have filled things out. I just like some of the language here for you guys. Usually what happens is the body becomes metabolically resistant. Listen, gang, when you start, I'm going to back up. I'm going to back up. When you do a consult, you're not supposed to be prescribing. You're not supposed to be solving for them. You're not going to give them the full detailed breakdown. A lot of times people feel so confused when they come in. You'll hear a lot of language. This is actually a traditional marketing kind of hook, but it does help. There's some truth in it that people, when they feel really stuck, they've tried everything, they feel hopeless, they feel helpless, they're not sure, they're confused, they're excited, they're a little bit all over the place. You can just say, you're in the right place. If you've been confused, it's okay. It's understandable. So some people will say it's not your fault. Well, okay, because we want to take some pressure off them. You can just say, it's understandable. There's a lot of noise out there. You're in the right place. We provide clarity here. So you don't have to make somebody a victim, right? You can empower them. It's understandable. We got you. You want to do what Dr. K did. You want to instill confidence. We are so confident in what we do. We keep it simple. We keep it clear. We got you. We got you. We got you. We got you. So really, what's your number one outcome? You identify answers. And when you know what it is that they really want, what you're going to ultimately deliver, what you're ultimately going to build, what you're ultimately going to make available is an outcome-based model. And we'll talk more about that in upcoming business classes because, gang, really and truly, what I want you to get good at is feeling comfortable in who you are and how you help and who you help. And you don't need to do 20 things. You can do a couple of things really, really well. Stay in your zone of genius, bring in others of excellence around you, have an incredible network, have incredible, referral relationships. You do not have to be an island unto yourself. That's why you're here. And where I think one of the most exciting things, and this is where I'll wrap up and we'll take a couple of questions and we'll close it for tonight. What I think is really wonderful about peptides is because of the fact that they are not a one and done. Because you use them in cycles, you use them for outcomes, you use them for periods of time, and then you'll rotate to other molecules. You'll integrate them with other components in your clinical care plans. What I think that they've done really well is they've helped to set up memberships. Like membership is access to the things to get the results, right? Different types of memberships, different types of things that are going to retain that client. So it's not I'm coming in once, paying my copay, maybe I'll be back next year. They're coming in again and again and again because you've helped them actually get outcomes. And they like it. They like you. They like what you offer. They trust you. They know, like, and trust you. So we want to retain because the probability of selling to an existing client is 60 to 70%, while the probability of selling to a new prospect is just 5 to 20%. So you don't need to sell the kitchen sink the first moment they come in, try to give them 20 new peptides and $1,000 in supplements, and they leave with a big bag of stuff and you never see them again because they have buyer's remorse. They didn't understand. They were too embarrassed to come back and say, I don't know, or I just want to return all this. This is not what I was expecting. So think of any patient the same way you would yourself. How would you want to be cared for? If you were going to pay out of pocket and go to somebody's place, if you're not a client program similar to yours, go be a client somewhere. Invest in it, go through it yourself and understand the value that you do deliver. Because when you can retain people, they will be your raving fans. They'll help to refer people in because acquiring new clients, again, as smaller businesses, cash pay businesses, marketing is the thing. So we have to find how we comfortably and affordably can show up. It can be word of mouth in your local community. It can be, networking. It can be volunteering. It can be at the Better Business Bureau, like, it can be at any of those types of things. It doesn't have to all be online on social media and paid ads. It can be one of the things that we did in our practice, and it really actually is quite effective. Every new client that ever came in, we gave them a tour of the practice because we did more than one thing inside of that practice. So they might have been there for one key outcome, and we were always going to speak to that and address that. But in taking them through the facility and helping them to know how we specialize in the thing they wanted, we would also highlight our other specialists in our ecosystem and the other types of programs or solutions, because look, they could have a spouse that needed what the other doctor had, right? So you never know. And so it doesn't, when I say, just like when I talked about Dr. Wendy, to think differently, instead of trying to be another me too, I was like, well, if you're having the conversation every day that people are failing on GLPs, then offer hey, GLPs failing you? Stalled out, right? So the same thing. I'm not asking you to try to compete with whatever anybody else is doing. Meet yourself where you're at, understand what feels good for you, understand your budget, your time, your energy, your resources, and simply start there. Meet yourself where you're at. Then you will retain your people because you'll be providing amazing care. You will build over time, because if you're doing one-to-one now, you'll go from one-to-one to one to a couple, right? So you can go from single services to a package, from a package into a membership, from a membership into a program. And I am going to say one thing. I recently changed my stance on this because I've coached y'all for so long. And when we made a transition from insurance to cash, we went right into high ticket. We went into programs. And we did it, and it was like, we got to do it. And I'm glad we did. I would never, ever change it. Okay. However, if you don't already have the right infrastructure, designing a program is a heavy lift. It's a heavy lift. So I've actually flipped. I believe that programs are where we end. They're not where we start. I believe we start and we get really good on the single visits. And then from the single visits, we start to put some things together. And if we want to call that a mini program, if you want to, but it's really a bundle of some things that you can go, okay, I know this is going to happen over the next 4 to 6 weeks. When we start to build programs are at least 6 months often if you're actually going to get good results with people. Like, they're a chunk of time. And if you're doing things and you're managing people and you've got coaching, if you've got multiple services, it becomes a lot. And it can become complex. And then you can be like, I'm going to do it. But then you're like, I don't know where to start. I'm freaking out. And you'll stop. So please be kind to yourself, meet yourself where you're at, notice what's working really well, build on that, and that will help your business to grow. So before we wrap it up, shoot, it is 1/4 after. I'm so sorry. Dr. Melissa, I see the same recurrent theme with other providers here all the time: failure on maximized dose of GLPs, and they come for a higher dose. Clear indication that whomever prescribed their GLP therapy in the beginning ignored everything else. Yeah, 100%, Dr. Mikolos. And we really are seeing that, gang. And unfortunately, if you all didn't get the opportunity to watch Dr. Ellis's masterclass that we did a couple of weeks ago, he spoke on it's the level, not the dose, especially with GLPs. Please watch that. It's definitely worth your time, because there's a lot that most people don't know, especially, unfortunately, the practitioner oftentimes prescribing an Ozempic or Mounjaro, because human trials, phase 3, there was a very specific way the dosing is supposed to be escalated. And when you're in a traditional allopathic model, especially if it's going through insurance, you have a protocol that you're supposed to follow. And so it's not a fault of the doctor per se, because they're just following the order, right? They're following what pharma told them they're supposed to do. And they haven't had the luxury of, I shouldn't say luxury, they haven't found their way maybe to deeper training, because they're just kind of like, I don't know. And they don't have time to figure it out because they're writing the next script and they've got 5 minutes, 7 minutes max for a visit. And so that patient will either be a failure, they'll go seek it out somewhere else, they go onto the influencers, they try to problem solve, and they don't know that something else exists. And so I really do feel like there's a powerful opportunity and conversation that any of you can lead in your own communities. So yeah, I think it's really great. Goated! Greatest of all times. That's right, Leo. What? All right. Internship. Interesting. I have first visit, and that has been great, but I still have to work on pricing. Megan, you're going to be great. Listen, gang, you guys, master classes are in the master class section. So every week when we do a class, all replays go in the clinical master class and clinical office hour. So it's on your dashboard. As a member, you guys have access to that. Listen, also, We did a business class at the top of the year. I didn't do slides on that one, but we really talked through and helped you guys to understand pricing. So when you're trying to figure out pricing, there is a lot that goes into it. You know, what we do inside the Practice Accelerator is we really break it down. We give you spreadsheets. We help to really go deep in it with you. These classes that you guys get to pop into every 6 to 8 weeks, because again, we have many classes as a member. So it's kind of rotating and jumping in. They're not always in a linear fashion, right, of where you might be in your own practice learning curve. So if you're at a point in your business and you really want to go deeper in developing your offerings inclusive of peptide therapy from a cash-based standpoint, then that's something for you guys. So, all right, listen, I love and appreciate you guys. What an amazing night. I can't believe there weren't more questions. So was this valuable? Did you guys, was it good? Did you guys get stuff out of it? Come on. Yeah.
Loved it.
Okay.
Good night.
I love you all. Okay, then
Thank
I will see
you.
you all soon. Next week is Sam. So Samantha Lander, we are doing a lunch and learn on the 21st. She's going to be doing a whole breakdown. She's going to do a whole clinical case review. She's going into diagnostics. We're going to be looking at gut, like she's doing a whole patient presentation. So nuts to bolts, how she approaches patient care, what diagnostics she's looking at, what peptides she's bringing in. She does a lot of foundational functional health work. So that is on the 21st. Again, always look in the community. The dates are always on the calendar. We're always putting things in and you always get emails from us. So if you've not white labeled hello at My Peptide University, keep an eye on your inbox for those and that will be there then. All right, take care, guys.